and welcome to this edition of Animal Health Today. I'm Hannah Lazar. With today's technological revolution and advancements in AI and science, we're seeing many breakthroughs in animal healthcare, treatments, and diagnostic tools. Today, let's take a look at a very exciting one. We'll be talking with Andrew Brown, the founder of Global Innovative Platforms, a company dedicated to animal healthcare diagnostics and the exciting groundbreaking work they are doing in heartworm and other disease testing.
Our company is Global Innovative Platforms, a publicly traded company under the ticker symbol GIPL. The moment we realized this wasn't just an idea and it was an actual business was actually more recently when we were successful with our mission of creating our first initial heartworm breath marker from both the mature stage of the disease and also the early detection side of the disease. We started this out about 4 years ago as a hypothesis. It started from Dr. Byron Blackburn at Auburn University, and he had a hypothesis that this would be the next wave in animal diagnostics. And we took that data and we ran with it. There are a few different factors that really contribute to our current success. We have identified the most sensitive gas chromatographer photoionization detector in the world that we are familiar with. And that sensitivity level is really what lends itself to this type of data collection and this type of analyzation. The sensitivity of the machine coupled with artificial intelligence in order to build our breath markers were the two factors that really had to come together for us to be successful. What makes our technology different from any other type of diagnostic out there now is we are, first of all, non-invasive, second of all, proactive, not reactive. We are looking for different markers inside of the body and different signals that come from a disease that show us the disease is present, and it is not the same signals everybody else has been looking for with different tools. We chose to start with heartworm because there is a huge problem with all of the current heartworm tests on the market. There's a 6-month lag in detection from all of the point of care tests, and by the time it's identified at 6 months, it's too late to completely get rid of it. Currently, with all heartworm point of care tests that are on the market, it's not able to identify the disease until it's at least 6 months mature, and at that point you already have irreparable harm to the heart and lungs. You're shortening the life of the dog, and they will always have breathing issues. When they're given a medication, first of all, they're extremely expensive, and second of all, they're very challenging on the dog's body. We want to identify it in the early stages where we can change the treatment protocol, simply give the dog a preventive, get rid of the disease, have the dog come back for a confirmatory appointment 40 days later to confirm that it's gone, and then prove later on that there is no long-term harm to the dog's lungs and heart. We're thrilled that our initial studies have come back with such great numbers. And the goal of all of this is to identify these diseases and abnormalities at their earliest onset where we can do the most about it. It's all about early detection to save lives, save money, and make the pet feel more safe. What we have built is a non-invasive breath test for all animals for many different diseases. We have members of the American Heartworm Society on our team that are guiding us. In the animal business, and with this product in particular, there are about 30,000 vet clinics in the United States and about another 4,000 or 5,000 shelters as well. We know, and we have a strategy that we've used in the past with different products that can be used again here to penetrate this market. And we also know that we have a product that is heads above anything else that's out there. And as we continue to educate the market, the patients and the dogs are going to demand this type of quality. The milestones that really matter the most in the next 12 to 18 months are building out not just our heartworm breath test, but a complete parasite panel that will include hookworms, roundworms, whipworms, giardia, tapeworms. Then we will also approach the tick-borne diseases of Lyme disease, anaplasmosis, Ehrlichia, and then we will continue our research and development into other animals. And not just building it out to get the initial markers, but obviously we need the proper specificity and sensitivity and accuracy levels, and that's really the stage we're at now. When we're successful with this worldwide, it totally changes the landscape with animal diagnostics. We're looking to identify all different types of abnormalities at their earliest onset so that we can minimize losses and maximize results.
Up next, Healthcare industry executive Roger Hayes shares his views and motivation for working with an exciting, groundbreaking company in animal healthcare.
As a pet owner, what frustrates me most about the way diagnostics have been done, not just today, for the past 30 to 40 years, is the delay. We have been waiting too long to detect these disease states. With heartworm, for the past 34 years, the standard quo has been a blood test, needle sticks, very invasive, and it can't detect anything until at least 6 months. But by 6 months, irreparable harm is already happening to the dogs. When we look at things like diagnostics using breath, which is non-invasive, and it can detect things like heartworm earlier in the stage, now we have the opportunity to take some preventative measures instead of just reacting. And being on the prevention mode is so much healthier for the dog. It's healthier on the pet owner, it's healthier on the wallets. All around, it's a win-win situation. We have a way to catch things earlier. Current blood tests wait for something to be present, a parasite to be present, waiting for a symptom to be present. And with the breath, we turn that on its ear, and we're actually listening to the biology of the body. When I take my dog to the vet, he doesn't like it. My dog has to know. They're gonna grab him as gently as they can, and then they're gonna hope they can find a vein on the first stick. They're gonna tie that tourniquet on, and they're gonna get that blood out. And the whole time my dog is scared. With the ability to take a cone and gently put over his muzzle and allow him to breathe for 30 seconds, and then before I even leave the office, I know, yes, he has heartworm. No, he doesn't have heartworm. When the opportunity came around for me to go to work for Global Innovative Platforms, I was thrilled. But then I've always been attracted to cutting edge technology and services. And that's exactly where we are with being able to provide diagnostics in the animal space using breath capture. When you look at the team that our founder and CEO, Andrew Brown, has built, it's phenomenal. And it's easy to see why people are so excited about what we're doing. When you look at the success that Andrew has had in his past in building companies and building a team of great people, such as Dr. Lindsay Starkey and Dr. Alyssa Campbell, and these are stalwart figures in the veterinary space, absolute icons in parasitology.
Dr. Lindsay Starkey is known as a pioneer in animal research and parasitic science. She studied under and worked with the legendary Dr. Byron Blackburn and continued his life-changing research after he passed away. She is at the forefront of exciting research to provide early detection and possibly elimination of certain diseases that are causing serious health problems for animals and their owners. So next, Dr. Starkey shares some of the exciting breakthroughs she's working on and that she sees coming in the future.
Heartworm has been and continues to be a struggle to detect, especially early on in the infection. And I think what a lot of veterinarians don't realize is when heartworm first gets into the dog or the cat, it's in the tissues. It's chilling. It's not in the vascular system. It's not in the blood that we normally take a sample of to look for it. So it's living this kind of covert lifestyle there in the tissues until it becomes mature enough for us to tap into the antigen that's put out by the adult worms, or if we're talking about cats, the immune response to the heartworm, which still has a lag time associated with detecting the antibodies there. So the good thing for heartworm is it can fly under our radars very well, especially early on in the infection, because the targets we go to look for, that we know to look for, are things that don't really exist until that infection becomes more mature. VOCs, volatile organic compounds, there's something technologically we've known about for quite a while. Think from the human health side. If any of you have ever been tested by your primary care physician or another physician to look for ulcers, you've blown air into a bag, and then they take that bag and they decide if you do or don't have the bacteria associated with gastric ulcers. I've had to do that before too. That is detecting VOCs, or these changes, alterations, which are kind of byproducts from something going on in the host. We exhale these compounds. These compounds are also emanated not only from our breath, from our skin, from hair, from all over the place. If we can narrow down specific ones in breath associated with specific pathogens along the same lines that they've done with Helicobacter and gastric ulcers, now we've got a really non-invasive way to look for something like heartworm, which currently requires a blood sample. If we can use this breath technology, for basically anything in the practice we would be interested in answering. I think that potential is there. What could be a miraculous tool to this non-invasive, all I need is your breath sample and I can get this whole portfolio potentially of what's going on inside your body, because that is almost the easiest window to look at what's going on inside. Not only is this VOC technology dog specific or heartworm specific, this is something that we can test environmental for looking for things in a housing type setting, commercial poultry, cattle facilities, right? We can do that. We can potentially detect VOCs coming off of a food source for detectable fungal signature. Everything has a VOC portfolio or profile that comes with it. Knowing what it means is the hard part. And so this is a technology that could expand far beyond dogs to other hosts, far beyond parasites into other pathogens, other infectious things. The breath diagnostic role is only going to explode from here, and that's super exciting. Andrew was persistent, and we got together and had some really intense conversations about building on what the Auburn team had kind of started back in, God, I don't know if it's 2017 or 18, a small team of myself, Dr. Byron Blackburn, and Dr. Sarah Zodi, but Andrew picked it back up, first starting with Byron and then with me, and there's a few parasitologists on the team, plus experts in all those other respective facets that bring this whole breath portfolio detection thing together.
Our next guest, Bruce Truman, has been consulting the veterinarian industry, doctors, practices, and animal medical care companies with new technologies and innovations for decades. Today, he shares exclusively with our viewers what excites him about the future of animal healthcare.
Global Innovative Platforms has a top-notch management team. I always look for two things when it comes to a founding management team, because that's what my organization does for a living, is scale up companies. We look for, number one, founders that have had previous success and a previous exit. We check the box there. Then the other thing we always look for, especially in the veterinary space, we look for a pain point or a problem that's being solved. And this platform and this management team check that box also, because this is the pain point, the blood draw. This is non-invasive, and it really addresses that issue. Veterinary medicine has been historically slow to adopt most new technology. Veterinary professionals are science-based, so they want to know the science behind something. So generally speaking, it's a slower audience to adopt new technology. This is the first non-invasive test that's going to be in the industry to make it so much easier to test a dog for heartworm. And it's critically important that dogs stay on heartworm preventatives. Large practice groups look for ease and convenience. So if you're a large practice group, you're worried about your healthcare team. You're worried about potential needle sticks. You're worried about the time it takes to do a test. So if we can introduce something to them that makes that process simpler or safer, they're going to be very interested in it. This is extremely disruptive to the current technology that's out there. This is a complete change from anything that we've seen, almost to the point where at first people are quite skeptical that it actually works. Once you get them over that and say that the test really does work and has been developed by leading scientists, everyone's extremely excited about this. When the company comes to market with something new, it will be well received if it has the proper clinical validation, which it's going to, because the leading experts in the world are working on this. Caring for pets in the community is critically important, and I am on the advisory board of an organization based out of New Orleans called TIP, the Inner Pup. We all want to grow up with a pet, and I believe strongly that TIP is doing the right things in the market to help those pets have free veterinary care in New Orleans, free heartworm preventative, that's a hot topic, and also free parasite controls. One of the companies we work with is the Senior Dog Veterinary Society. It plays a critical role in the industry because we're educating and credentialing veterinarians and veterinary technicians on the proper care of our senior dogs. It's a great initiative.
Coming up next, learn about senior dogs and the extra care they require and the amazing benefits their owners receive.
I think a lot of people miss out on recognizing that older dogs are different. As dogs enter into that phase of their life, they're going to be impacted by different diseases of chronic pain, diseases of age, and a lot of different changes to their body that you're going to need to kind of help support and help them accommodate. The reason why I started focusing on senior dogs was because of my own dog becoming a senior when I was in vet school. I had a Westie named Frodo Baggins Tarantino. He was this little guy, and he was healthy his entire life until about age 10. When he hit age 10, all of a sudden he went from being this really healthy dog to a dog that I couldn't keep out of the animal hospital. And so as I fell in love with him and started watching all of his needs change, I realized that I really wanted to help pet parents and help this demographic of patient. No senior dog ages the exact same way. They will all have the same aging process happening, but the care that they need is going to be very different depending on if you have an older Chihuahua versus an older Retriever. They will have different diseases that will impact them. So figuring out what that older dog needs as they get older is really important.
Our next guest, Dr. Rusty Moore, is one of the top veterinary authorities and animal educators in the country and has written multiple books on the human-animal bond. Dr. Moore is a dean of the Ohio State Veterinarian School and is here on Animal Health Today to share ways for you to have a better relationship with your pet.
I wrote Unleashing the Bond, Harnessing the Power of Human-Animal Interactions because of the importance of actually educating all people, not just pet owners, but it could be human health care, veterinary care, and others. And it's really a blend of science, history, and personal stories that are all blended together. So it's really a comprehensive look at the human-animal bond. First of all, it's bidirectional. I benefit from the interaction, they benefit, we benefit from the positive health benefits from interacting with animals. Lower blood pressure. If you have a dog, you're less likely to be obese because you're going to be walking. So there's a lot of physical, emotional, mental, psychological benefits on us, but also there's benefits on the pet as well. But by looking at that dog as an individual, if it's a Great Dane, it needs things that a Chihuahua don't necessarily need. It needs space. It probably needs exercise outside. Probably don't want to live on the 18th floor in downtown New York. It's those types of things. It's the diet. But it's really also, as I alluded to earlier, it's about the bond and how we're imposing on them sort of our humanization of them. And that we don't necessarily, if you have a really fearful, skittish dog, we might want to treat that dog differently and do everything we can to reduce fear and stress and anxiety. Right now, we're in an information explosion period, and actually one of the largest, quickest transformations happening in veterinary medicine and animal health care. And a lot of that is driven by technology and also on research. And so I think a new pet owner or a current pet owner should do their research. They should ask reliable sources of information. If it's animal health, they should be asking veterinarians or veterinary health professionals. And if they're doing their own research online, whether it's the internet or whether it's on social media, not everything you read is accurate. And what we believe today might be proven wrong tomorrow just because of research. So be very critical of what you read. Make sure you can probably back it up with another reference or two, ask your veterinarian about it. And so those things are the things I think you can do to improve the health, well-being, and longevity of your pet's life. What we think is a incurable or a disease that you can't really manage effectively today, tomorrow really could be completely different. These continual research developments for veterinary medicine, whether it's nutrition, whether it's a vaccine, a prevention type thing, all of that stuff is going to improve the health, well-being, but also the bond. And that also goes for behavior, which is why we're here at the VMX, the largest veterinary continuing education forum in the world, because people in the veterinary profession are constantly wanting to be on top of the latest, greatest development so they can provide the best possible care to their clients and their pets.
In our next segment, see what one of America's most well-known veterinarians has to say about the future of animal health care.
The most prevalent issue with pet care today is, I think for some pet parents, sometimes the affordability of veterinary care can be really an obstacle. We work hard to try and give people options. In our practice, we have wellness plans that allow people to pay over time. We try and have payment options that are affordable. I was taught it's not my pet, it's not my money, so I better give them a treatment plan or an estimate so that the pet parent can decide what level of care and what are they comfortable spending. The most common ailments that I treat in my practice tend to be a pet that's limping. In Florida, skin problems are huge. Heat stroke is something that we see a lot because people will go and exercise their pet because they're off that day. Their pet is not as well exercised, or it's the wrong temperature for them. Vomiting, diarrhea are common things, and one of the things we see is probably a lot of bad breath for animals because they have a lot of dental disease, and then pain management. I want my pets to live forever. So forever involves trying to figure out not just preventative care, but proactively, like preemptive care. To be able to live a better, happier life, that may mean different things to different pet parents. So as a veterinarian, when I'm seeing you with your pet or a family member with your pet, I want to find out what are your goals? What do you want that pet to do? Some people that we see do competitions like agility or dock diving. That pet has a completely different lifestyle than the couch potato bull mastiff that just lays all day on the couch and is just going in and outside. Families come in and have Googled things. They really are interested in finding out the why, and they want to be better educated, ask better questions, and make better decisions for their pet. So I want us to partner over that pet's lifetime and collaborate on the care.
Coming up next, an interview with Dr. Adam Chrisman, nationally known author, thought leader, podcast guru, and host of the DVM 360 live talk show.
The future of animal healthcare today is so exciting. This is such a great time to be both a pet parent and a veterinary professional in terms of both the technology that's made available to us. The ability to recognize access to care has been an issue, but now we're actually doing something about that. And doing something about that involves using AI technology and then also telehealth and telemedicine and virtual care. Yes, it's been there for a few years, but now it's different. Now we understand the fact that we can do things a little bit more proactively in regions of desert locations, for instance, where there aren't veterinary hospitals, but we can actually do physical exams and help these animals out as best as we can. We now know and we recognize and appreciate that the pet owner is in the driver's seat. I love the fact that we're really engaging with the pet parent. We're reframing the way we're making our recommendations. For example, if I'm flipping the lip and I know for a fact that this dog needs a dental cleaning, but I want to get their buy-in. Let me show you something, Mom. What are your thoughts, Dad, on this tooth? Do you see what I'm looking at? See how there's that mobility going on? Do you think it'd be a good idea that we do some dental cleaning? That's where that gnarly breath is coming from. I really want to get that teeth out because I know you love your fur baby so much. You want to extend the longevity and lifespan of your pet. I really want to educate them on the basics of the veterinary community and the fact that we're on the same side of the exam table. We could be portrayed as a villain because we want to get paid and all those different things. Yes, healthcare generally is expensive, but we really are in it for the greater good of their animals. It's the calling that we all have. There is a couple areas where I think pet owners fall short, not to their dismay. I just think that we can do better education on it, and I think it's preventive medicine. I do think that when they come in, like, oh, I didn't know that they were saying, I didn't know that limping could be associated with pain. I didn't know that not eating for days could be associated with some sort of an obstruction. So I do think for preventative care, having those real proactive conversations about things, and specifically just diagnostic testing, the fact that we have innovative ways of testing things from fecal testing, new ways of doing a heartworm test now through a breath test, which is amazing. And then also we have some really great methods of learning about vaccines and the importance of the why. So the book is called Honey, Have You Squeezed a Dachshund? For Pet Owners Guide. Pet owners who are terrified of IBDD, which stands for intervertebral disc disease. The purpose behind that book is to be more proactive in recognizing intervertebral disc disease. We don't want it to get to the point where they're permanently paralyzed. But, and a huge but, they live wonderful lives if they do. There's carts that are out there. They have great physical therapy modalities that are out there. If you haven't seen the shows or haven't listened to the Vet Blast podcast, the number one thing is to know the science and the beauty behind the human-animal bond. It's sacred, it's powerful. I think it's the most powerful bond that exists on the planet. So the science is where we educate our fellow professionals about some of the new drug releases and therapeutic areas and subject matter experts on the podcast. And then from the pet owner's perspective, just showing the beauty and even the goofiness that we love our animals every day. And every day is your pet's best day ever. I love the fact that we're doing some DNA testing for our pets, getting a more proactive approach of seeing genetic predispositions, because I think it's a big thing. We just spoke about IVDD. We know that there's a genetic correlation, so now be able to identify that. I love that there's liquid biopsying, whether it be through urine samples or blood samples, to identify possible cancer screenings that we're doing now for dogs and cats. We still got a ways to go. I love that we're doing injectable medications that are long-term release, sustained release for flea and tick prevention, heartworm prevention, pain management, and allergies. Allergies is a big thing. So we're seeing a lot of great work in monoclonal antibodies. It's been on the human side, and we're seeing it over on the veterinary space. I love the technology that we're seeing, from remote monitoring systems that we're seeing on the pet side of things, from wearable technology, from even from litter boxes to how we feed our pets and how we engage and behave and train our dogs and cats. And then on the flip side of what we're seeing on the veterinary side with AI technology and workflow utilization from our in-clinic as well as external partners that we're using with reference labs, the fact that we have really great diagnostic alternatives for the better, I would say, that we can do, from heartworm testing and fecal testing and digital cytologies and x-rays, are just incredible. It's such a great time to be a veterinary professional because we're just moving forward and closing those knowledge gaps even better and better every day. I don't have human children. I know some do, which is great. But our pets are just so special to us. There's something about them. And I love to reflect that and take that love onto my patients and to my social media following, because I know, and I can see it, I can truly see it in everybody's faces, that everyone cares. The question that they always have comes down to their heart. They care about their animal. Why do I need to give the flea and tick medication? Why do I need to come in for a recheck? Why do I need to refill the medication? All that's because they love their animal. At the end of the day, it's truly what it's all about. Get on the floor with your pets. Get on their level and enjoy them for 5-10 minutes. Take your doctor cap off, your tech cap off. Be your silly, unapologetic, authentic self, because your pets don't care. They just want love. They don't care who you love, the color of your skin, anything else. They just love you more than life itself. And if there's one thing that we can learn about our pets is that love is truly amazing and it has no boundaries.
That's our show today. Thank you all for tuning in. A special thanks to all our guests and to the VMX conference presented by NAVC. And thanks to their hospitality, we were able to witness the vet community interacting and working together to make sure your pet lives a longer, happier life. See you next time.